Welcome back. I'm Les Flamer, founder of the Medigap Savings Network. I'm a senior like you, and my mission is to help other seniors make good choices and save money on Medicare supplemental insurance. In our initial module, we discussed the steps you need to take to sign up for Medicare. In our second module, we looked at Medicare in depth, Part A, hospitalization insurance, Part B, medical insurance, and we also explored prescription drug coverage, Part D. Although Medicare benefits are substantial, there's a significant portion for which you're still liable, and that's going to be the focus of our current session. Our focus in this module is to explore how to cover those gaps and avoid additional medical expense. We'll explore two approaches, how coverage differs under each approach, and how the costs compare. You'll then be better equipped to make an informed choice as to which approach best matches your situation. So let's get started. To control costs, the Center for Medicare and Medicaid Services studies cost changes and publishes an annual schedule of approved payments for services and procedures. Participating healthcare providers who accept Medicare assignment will be promptly paid for the procedures and services according to the schedule. Non-participating providers accept Medicare patients but do not accept Medicare assignment. They reserve the right to charge Medicare patients slightly more, up to 15% under the current law, but this is less than 5% of all providers. They bill Medicare the approved scheduled amount and bill you the balance. Finally, there are some medical providers who do not accept Medicare patients. Although the scheduled approved payment rates are considerably below what patients are typically charged, the Medicare patient's 20% share can still be substantial. Costly procedures or extended illnesses can wipe out savings rapidly. As we age, we become increasingly susceptible to the big three: cancer, heart attack, and stroke. Major surgeries are also more common. All of these are not just threats to our health, but they also threaten to wipe out personal savings. Even minor problems can be costly. My wife experienced blurred vision one morning. She called the on-duty nurse at our provider, who advised us to come to the emergency room immediately, probably fearing the onset of a stroke. The 1.5-hour visit and tests cost $9,000. Without additional coverage, we would have been charged 20% or $1,800. Other major procedures are common among seniors, like joint replacement. Hip or knee replacement is increasingly commonplace and exceedingly costly. The average cost for a knee replacement is about $50,000. A 20% share would be $10,000, but often both knees are replaced, doubling the costs. There are two approaches to covering these additional expenses: a Medicare Advantage plan or Medicare Supplemental insurance. Medicare Advantage is also referred to as Part C. Medicare Advantage replaces Parts A and B. The provider delivers all of the A and B benefits and typically offers additional benefits as part of their plan. Prescription drug coverage is often included. Medicare supplemental insurance plans are provided by independent insurance companies to pay all or some of the costs not provided by original Medicare. There are two types of Medicare Advantage plans: HMO, or Health Maintenance Organization, and PPO, or Paid Provider Organization. The HMO approach is a closed network of provider-owned facilities. Doctors and medical staff are typically employees. The HMO requires a member to choose a primary care physician who needs to make a referral before specialty care is provided. Prescription drugs are often included in the plan. Healthcare is not normally available outside of the network, except in the case of emergency care or pre-approved urgent care when traveling outside of the network. In most cases, the patient will need to pay for emergency or urgent care services provided and seek reimbursement from the HMO at a later time. The PPO approach is a network provider-based approach. You do not need to choose a primary care physician and can go directly to specialists without a referral as long as they are network providers. Costs will be greater when not using network-approved providers. In most cases, PPO contract with doctors and medical facilities. In some cases, individual providers or clinical practices leave the network and are no longer network-approved providers. In these cases, patients would need to select new providers. The MA approach offers lower premiums, but there are copays and coinsurance payments when services are delivered, though they're typically much lower than payments required under Parts A and B alone. Typical copays for doctor visits are $15 to $20. For a specialist visit or lab work, a $30 copay is typical. A major service like a colonoscopy or MRI may be $250. There usually is a charge for hospitalization. $285 per day for the first 7 days and no charge thereafter is one example. By way of comparison, Part A charges a deductible of $1,340, but no daily charge. These costs are only examples. Each plan is different. Each plan has a maximum out-of-pocket or MOOP, which varies by plan. Typically, maximums are $3,400 to $6,700 per year. To recap, Medicare Advantage plans have low to no premiums. Hospital and medical services require payment as they are delivered with copays and coinsurance. Charges are substantially below what would be required if you just had Medicare Parts A and B. Each plan has an annual out-of-pocket maximum, which can range up to $7,000. Each network has restrictions, and the HMO is the more restrictive. Medicare Advantage plans are not available everywhere and are typically found in densely populated urban areas where providers can support a network delivery system. Some plans offer additional benefits like subsidies for gym membership, discounts on eyeglasses, hearing aids, and other benefits. There's usually no charge for preventive care. MA offers low upfront costs, pay-as-you-go with copays and coinsurance, and generally restricts care to network providers. There are some costs, but they are substantially less than if you only have Medicare Parts A and Parts B. Medicare Supplemental insurance is provided by independent insurance companies, but benefits for each plan are stipulated by Medicare. There are three major plans. Plan F pays all expenses, no out-of-pocket. Plan G pays all except for the Part B annual deductible of $183. Plan N does not pay the annual deductible of $183 for Part B and additionally requires copays of $20 for doctor visits and $50 for emergency room visits. Insurance companies need to deliver identical benefits under each plan, but are free to set their own premiums. Premium costs vary widely within the same market. MedSup augments Medicare Parts A and B. There are no network restrictions. When you travel, the plan travels with you. You can use any doctor or facility that accepts Medicare patients. Depending upon the Medicare Supplement plan that you're on, your fees would match generally what you would normally pay at home. In the case of Plan F, no out-of-pocket. In the case of Plan N, there would be a copay of $20 for a doctor visit. So how do the major plans compare Medicare Advantage versus Medicare Supplemental insurance? Medicare Advantage, low or no premiums. Medicare Supplemental, there is a premium paid monthly, quarterly, or annually. Medicare Advantage often includes prescription drug coverage. Medicare Supplemental, the carrier may provide prescription drug coverage, but it would be a separate Part D policy, or you would be required to get a Part D policy from another provider. Pay-as-you-go, copays and coinsurance under Medicare Advantage. Under Medicare Supplemental, Plan F, no additional costs. Plan G, only the $183 deductible. And Plan N, the deductible plus the copays. For Medicare Advantage, maximum out of pocket, $4,000 to $7,000. For Medicare Supplemental, there are no additional charges. Hopefully this has helped put things in perspective so that you can get an idea of what best matches your needs. I would encourage you to go to our or go to our resource center rather, and download the slides for future reference. There's also additional other information, Medicare and Medicaid services, official guides, checklists, other articles, and I've provided some contact numbers and web links. Of course, you can give me a call. I'd be happy to answer any questions or to provide you a quote on the direction you'd like to go. My toll-free number is 833-633-4426, extension 101. And thank you for joining us today.